Okay, great. So thank you everyone for joining our session today on statins and atrial fibrillation. My name's Harriet Robinson. I'm a GP working in South West London. Please feel free to write your name and email in the chat if you'd like to receive a certificate at the end of the session. And if you have any questions as we go along, please put those in the chat as well, and we'll aim to discuss these at the end of the session. So next slide, please. So in terms of what we're going to cover today, so we're going to discuss what cholesterol is and why it's important, why you might have a high cholesterol, what statins are and how they're taken, and who they should be prescribed for. We'll discuss how effective statins are, as well as some potential side effects and issues. We'll then discuss what atrial fibrillation is, how AF presents and how it's diagnosed. We'll then discuss some of the associated risks with AF, as well as how AF is treated. And next slide, please. So what is cholesterol and why is it important? So cholesterol is a fatty substance in your blood, which comes from the food you eat and is also made in the liver. Some cholesterol is essential for the body to help make healthy cells, certain hormones, and to help absorb food from the bowel. But too much cholesterol can be a problem and can lead to fatty deposits in the arteries, which can make them narrow and contribute to several different health conditions, such as heart attacks and strokes. Broadly speaking, there are two main types of cholesterol. So there's good cholesterol or HDL cholesterol, which takes cholesterol from blood vessels back to the liver. And then there's bad cholesterol or LDL cholesterol, which carries cholesterol from the liver to the tissues and which can lead to the buildup of fatty deposits in the blood vessels. And next slide, please. So this is summarized in this diagram. So the blue arrow represents HDL or good cholesterol, which takes fatty deposits away from the blood vessels. And the red arrow represents LDL or bad cholesterol, which takes fatty deposits to the blood vessels. And this can cause them to become narrow or blocked. And then this can contribute to health conditions such as heart attacks and strokes. And next slide, please. So why might you have a high cholesterol? So there are several factors that can influence this. So there are modifiable factors, so factors which we can control to some extent. So these include diet. So having a diet high in saturated fat, for example, can contribute towards a high cholesterol. Other modifiable factors include smoking, having a low level of physical activity, having a raised body mass index, so particularly a BMI over 30, and having a higher level of alcohol intake. And then there are non-modifiable factors, so factors that we can't control. So these include age. So higher cholesterol is associated with being older. Sex, so being male is associated with higher levels of cholesterol. And then there's family history and also going through the menopause. High levels of cholesterol are also associated with other health conditions, and these could include having an underactive thyroid, having diabetes, so type 1 and type 2 diabetes, and having certain liver disease and kidney disease. So next slide, please. So how can we lower our cholesterol? So there are several sort of lifestyle factors that we can employ to help lower our cholesterol. So the first one being diet. So we can swap saturated fats for unsaturated fats, and ways that we can do this are listed here. So for example, we could swap butter for vegetable oil spreads, swap whole milk for skim milk, reduce the amount of red or processed meat that we're eating, and instead try to increase levels of lean protein in our diet, so fish, chicken, or plant-based proteins. And we can also eat more high fiber food. So fiber reduces the amount of cholesterol being absorbed into the bloodstream, and we can increase the level of fiber in our diet by eating fruit and increasing the amount of fruit and vegetables, things like oats, seeds, and nuts. So the second thing we can do is exercise. So we should be aiming for about 150 minutes of moderate intensity activity spread over 4 to 5 days per week. And we can also stop smoking and reduce alcohol consumption. And so next slide, please. So what are statins? So statins are a medication which block the production of bad cholesterol in your body. They do this by inhibiting an enzyme in the liver. So statins are taken once daily in the evening and are usually prescribed as a long-term medication. There are multiple different brands of statins, and these are shown in the box on the right. So atorvastatin is the statin that's most commonly prescribed in the NHS, but we see all these other types of statins prescribed as well. Next slide, please. So who are statins for? So statins are most commonly given as a preventative treatment to reduce the risk of people developing certain conditions such as heart attacks and strokes. And statins given in this way is called primary prevention. So treatment is therefore recommended when people feel well, so before conditions such as heart attack and strokes have had a chance to develop. So this kind of preventative treatment is recommended for people with certain health conditions, for example, type 1 diabetes and chronic kidney disease. And it's also recommended for people who have something called a Q-risk score, which is 10% or higher. So Q-risk is essentially a calculator which predicts an individual's risk of developing cardiovascular disease over the next 10 years, and which takes into account all of the factors which are included in the calculator on the right. And we'll discuss more about Q-risk on the next slide. So next slide, please. So yes, so as I was saying, so Q-risk is a calculator which predicts an individual's risk of developing cardiovascular disease in the next 10 years. Q-risk uses information about your own personal health to calculate your personal risk score, and this is expressed as a percentage. So a Q-risk score of 10% or above is moderate risk, and we start recommending statins at this level. A Q-risk score of 20% or higher is high risk and represents a 20% chance of developing cardiovascular disease in the next 10 years. Another way of thinking about this is to say that if there are 5 people with a Q-risk score of 20%, one of them is likely to become ill in the next 10 years. And we give statins to help reduce this risk. Next slide, please. So another setting in which we prescribe statins is called secondary prevention, and this is slightly different. So in secondary prevention, statins are prescribed for people who've already developed cardiovascular disease. And the aim of treatment here is to reduce the risk of further cardiovascular events, for example, heart attacks and strokes, in people who've already developed these conditions. In secondary prevention, a statin is prescribed irrespective of the individual's cholesterol levels, and it's prescribed at a higher dose. So usually in the NHS, we prescribe atorvastatin 80 milligrams. Next slide, please. So how effective are statins? So there have been several trials which have shown that statins are effective in reducing the risk of cardiovascular disease. One study which is referred to by the British Heart Foundation is the Heart Protection Study, which was a UK clinical trial which took place between 1994 and 2001. So this involved over 20,000 patients who were treated with either simvastatin 40 milligrams once daily or a placebo medication. So these patients were followed up for an average of 5 years in clinics, and the study found that for the patients treated with simvastatin, they had a reduced risk of death by 13%. They also found that for the patients treated with simvastatin, they had a reduced risk of major vascular events, so things like heart attacks and strokes, by around 25%. And this was for a wide range of different patients, including women, people with diabetes, and elderly patients. And this effect is shown in the graph on the top right, which is from this paper. So it's not in this study specifically, but there's also evidence that reducing LDL, so bad cholesterol, by 1 with statin therapy can reduce the risk of ischemic heart disease or stroke by over 20%. The next slide, please. So are there any potential side effects or issues? So yes, there are a few side effects and issues to be aware of. So in terms of potential side effects, one of the sort of most common side effects is muscle aches and pains. Some people can experience fatigue or sleep disturbance, and there's also the potential for gut symptoms, so things like nausea, diarrhea, or constipation. There are some rare but serious potential side effects to be aware of. So rarely people can develop a sort of severe form of muscle inflammation, and people can also develop liver and pancreas inflammation. There are some situations where statins shouldn't be prescribed. So these include certain forms of liver disease, people who are pregnant or breastfeeding, and for people with certain muscle conditions. There are also some interactions to be aware of. So statins interact with grapefruit juice. So people taking statins shouldn't drink grapefruit juice or eat grapefruits. They also interact with certain antibiotics and other prescription medications, but the GP or pharmacist should be aware of these. So next slide, please. We're just going to discuss some sort of myths or common misconceptions around statins. So the first one, so I do not feel ill, so I don't need a statin. So it's important to sort of focus on the fact that statins are not designed to make you feel better. So they're recommended when you feel well to reduce the risk of developing conditions such as heart attacks and strokes in the future. So they should be started when you're feeling well rather than when you're feeling ill. Everyone who takes statins gets side effects. So yep, that's not true. So approximately 8 million people in the UK take statins. The majority of people who take statins do not have any side effects, but for the people who do experience side effects, these are mostly mild. And then if I cannot tolerate a statin, there are no other options. So there are multiple different options we can try. So we can try a different statin dose. We can try a different type of statin. So on an earlier slide, I showed that there were different types of statins, so you can choose one of the other statins to trial. Or we can trial a different medication to lower cholesterol, for example, ezetimibe. And you can discuss these options with your GP or pharmacist. So for the majority of people, I think it's fair to say that the benefits of taking statins in terms of reducing the risks of heart attacks and strokes outweigh the potential risks, but it's important to be aware of these. So next slide, please. So now we're going to discuss a bit about atrial fibrillation. So atrial fibrillation is a type of arrhythmia. An arrhythmia is a problem with the heart rhythm. Atrial fibrillation occurs when the top chambers of the heart beat irregularly, which means that electrical signals do not get transmitted properly to the lower chambers of the heart. This causes the heart to beat in an irregular rhythm, which means it doesn't pump blood as well as it should. So the cause of AF is not always known, but the most common cause is damage to the heart, for example, from high blood pressure or having blocked arteries in the heart. Next slide, please. So how does AF present and how is it diagnosed? So there's sort of a wide range of symptoms that can be associated with AF. So it can present with palpitations, so an experience of heart racing, pounding, fluttering, or a sensation of missed heartbeats. Some people experience chest pain. Some people find it harder to exercise. Some people feel more tired or feel more short of breath or experience dizziness or feeling faint. But for quite a few patients, they don't have any symptoms at all. And how is AF diagnosed? So often it would be suspected by a healthcare professional, for example, identifying an irregular pulse on examination. If someone identified an irregular pulse, you'd then go on to have an ECG, which is the sticker test that this man's having in the picture. And we can see some ECG strips on the right. So the top image is an ECG from someone with a normal heart rhythm. And we can see that the spikes or the heartbeats are regular. And then below this is an ECG strip for someone with AF. And here we can see that the spikes or the heartbeats are irregular. It's also important to note that AF is not always picked up on a standard ECG because it can come and go. And in this case, people sometimes need a more in-depth investigation, which can be arranged by the GP or a hospital clinician. Next slide, please. So just a bit about the Harms 2 AF score. So the Harms 2 AF risk score is a clinical tool which has recently been developed and which predicts the risk of someone developing AF based on multiple factors, including modifiable or lifestyle factors. So it takes into account multiple factors, including high blood pressure, people's age, BMI, so particularly a BMI over 30, whether someone's male or female, if you have sleep apnea, and also smoking and alcohol history. And it gives a fibrillation score, which is a risk score essentially. And a total score of 5 and above is associated with an increased risk of developing AF. And so if someone had a score of 5 or higher, it would be useful to have screening either at a pharmacy or at the GP surgery. And next slide, please. So thinking about some of the risks associated with AF. So one of the main risks is heart failure. So 20 to 30% of people with AF are affected by heart failure. And this is where the heart doesn't pump blood as well as it should. So AF can lead to heart failure, and heart failure can also trigger AF. One of the main risks to be aware of is stroke. So AF can increase the risk of stroke by 5 times, depending on the presence of additional risk factors. So the irregular heart beating in AF can cause blood clots to develop, and these can then spread throughout the body, which can lead to conditions such as strokes. There are other conditions caused by these blood clots, for example, peripheral vascular disease, where blood clots disrupt the blood supply in the legs, and also ischemic bowel disease, where blood clots can disrupt the blood supply to the bowel. AF can also be associated with memory issues. So AF increases the risk of memory issues in a certain type of dementia called vascular dementia. And this is due to small clots being sent to the brain and a reduced blood supply in the brain as a result. And then death. So there's a 1.5 to 3 times increased risk of death in people with AF. So these risks demonstrate why AF is important to identify and to treat proactively. Next slide, please. And then some information about the treatment of AF. So there are 2 sort of main components to the treatment of AF. So the first component is heart rate and rhythm control. So the aim of this treatment is to help the heart beat in a regular rhythm, or to stop the heart beating too quickly. So we can do this with medications such as beta blockers, or procedures which can be done at the hospital, for example, cardiac ablation or cardioversion. And then the kind of second component of the treatment is anticoagulation or blood thinning. And the aim of this treatment is to reduce the risk of clot formation associated with AF, which can lead to several of the conditions that we mentioned in the previous slide, such as strokes. So we can do this with blood thinning medications such as warfarin or other medications like apixaban or rivaroxaban. And essentially an individual's risk of blood clots is balanced against their risk of bleeding, and the blood thinners are prescribed if the risk of clots is higher than the risk of bleeding. And this assessment is made by the individual's GP or hospital clinician. So next slide, please. Yeah, so we've reached the end. So in summary, cholesterol is essential for many body functions, but can in excess contribute to multiple health conditions, including heart attacks and strokes. Statins are a medication which reduce the formation of bad cholesterol and have been shown to significantly reduce the risk of people developing major vascular events. Statins can be taken as a preventative medication or after people have already developed cardiovascular disease. Statins are recommended as a long-term medication, often when people feel completely well. Statins have some potential side effects, but it's important to be aware that there are multiple alternatives that can be offered if so. Atrial fibrillation is a type of arrhythmia which can cause the heart to beat in an irregular rhythm. Atrial fibrillation can present with multiple different symptoms or no symptoms at all, and it's usually identified via an ECG. The main risks of atrial fibrillation include stroke and heart failure, but AF can increase the risk of many other health conditions. Treatment of atrial fibrillation includes medications and procedures to normalize the heart rate or rhythm, and also blood thinning treatment to help reduce the associated risk of strokes.